Thanks for the questions. Cool. So let's move on to number 5, the most common reasons why seniors fall. And I'm going to list them up here on the board. We kind of went over the systems, if you remember that come into the brain that help us tell where our body is at in position. So why do you think seniors fall? Okay. Yes, perfect. So first one is vision changes. And I talked about that just a little bit. As your vision gets worse, and I see quite a few of you are wearing glasses. As your vision gets worse, you diminish or decrease that system that helps you maintain balance. And so it's very common. Most of us, as we age, our vision gets worse. I'm already noticing changes in my vision. I have to kind of adjust where my wrist is at to see my watch now, so my vision is changing as well. So next one, yes, so we can become weaker. Okay, we talked about how your muscles not only need to be strong, but they have to contract in the right pattern. So that can cause a balance problem or a fall if you're weak or the muscles don't contract in the right pattern. Often what we see is a weakness in your hips, your gluteus medius in particular. And that's because as we walk, that muscle needs to contract to keep the pelvis level. As I'm standing on one leg, we're going to do a little test here in just a second to see what your balance is like. But if that muscle's weak and I'm standing on one leg and my pelvis drops, then I already lose my balance to that side, okay? So gluteus medius is often missed in balance problems and balance exercise programs, but it's a very important muscle, and we always make sure that we target it, okay? Next one, I'm just going to throw them out, posture. So as we age, sometimes our posture changes, and that can be caused, like I talked about earlier, people with balance problems oftentimes have low back pain and vice versa. Low back pain patients or people also usually have a balance problem. That's because as we age, we tend to kind of bend forward just a little bit. And I do a low back pain and sciatica workshop, and in there we talk about the main cause of that is because of degenerative disc disease, and as our spine collapses, we bend forward a little bit to take pressure off of the nerve. Well, balance-wise, if I'm bending forward even just a little bit, my head and my chest is forward of my knees and my toes, and my weight is already forward. So I'm already losing my balance forward, and I'm having to catch myself every time I take a step. So posture is a big issue in people with balance and fall issues, okay? Next one, sensation. And I'm writing these in 2 columns, and I'll tell you why. And this one used to be over here, but recently I've been able to move it over here. So we talked earlier about how people with neuropathy or loss of sensation in their feet and lower legs can have some balance problems because they can't feel. And then the last one is sometimes there's some drug interactions or drugs that we're taking. I'm not a pharmacist or a doctor, so how many of you in here are taking 1 or more medications? Yes, all of you, okay? So what I would recommend is you read those labels, talk to your pharmacist and your doctor if you're having a balance problem, and just ask them, could this be contributing to my balance problem or some of my muscle weakness? So like I said, I'm not a pharmacist or a doctor, but there are some drug interactions that you might want to look at, okay? So why the 2 columns? Exactly. So this side I can't help with, okay? I can't help you improve your vision, and you need to talk to your doctor or pharmacist about your drugs, your prescriptions, and drug interactions, okay? But this side, physical therapy, we can definitely help with strength and muscle coordination. We do that a lot. We can definitely help you with your posture, getting you back upright. Even just a little makes a huge difference. And this one, sensation, if you have some of that neuropathy, like I said, I used to have that over here, but recently there's been some changes, and we bought a class 4 laser, and we've been doing it on quite a few people with neuropathy in their feet, and we're having huge success. And so those patients that had a balance problem before, we do some treatments with this laser, and they start being able to feel their feet better. It's made a huge difference in how they walk and their balance. So we can usually help with all 3 of these things as far as your balance goes. Now, if it is a vision problem, that's only one of those 3 systems that we talked about. So in physical therapy, most of the time we can strengthen the other 2 systems to compensate for that vision problem or that poor vision there. So yes, perfect, thanks.